Gerald Miller is a fit retiree. The 74-year-old great-grandfather lives in San Antonio but travels for his hobby, mountain hiking, a passion that keeps him in good shape and brings him joy. A heart condition called atrial fibrillation threatened to knock Gerald off the trail. The blood thinner medication he was taking to control his stroke risk from an irregular heartbeat put him in danger of bleeding if he ever had an accident. Gerald opted for a more permanent solution. His doctor recommended a new technique at St. Luke's Baptist Hospital in San Antonio, a robot-assisted cardiac operation.
So that's the second thing that you saw, the echo right there.
Cardiothoracic surgeon Dr. Renata Ford is the physician at the controls.
It's something very dynamic. We're just trying to get to the chest without cracking your chest open.
In this procedure, the robot heart specialist is using a small clip to block off a tiny part of the heart, causing atrial fibrillation. That's just one of many cardiac procedures that can be performed in this minimally invasive way, including mitral valve and tricuspid valve surgery, tumor removal, atrial fibrillation treatment, placement of leads in the left side of the heart, repair of holes in the heart, and coronary artery bypass graft. Robot heart surgery is precise and localized. The surgeon is guided by a 3D image that's magnified 10 times. St. Luke's is one of only a handful of San Antonio hospitals offering robotic heart surgery. Dr. Ford says it's an important new option for people who may be putting off an important operation.
They're just afraid of undergoing any problem, any surgery. They think they're going to have the chest open and all those risks and everything. And we can offer an alternative to them that they might be leaning more towards having the surgery.
Advantages to patients are many. Less blood loss, less pain, and a quicker recovery. Patients leave the hospital the next day. Amazingly, this patient left the operating room after heart surgery with a few Band-Aids on his chest.
You stop your blood thinner?
Yes.
Okay.
Gerald is off his blood thinner. Only a few minor scars on his chest reveal he even had an operation.
Had surgery that day that I was admitted. The next day I was discharged, and within 5 days I was back out walking. And a couple days after that I was out doing 5 to 10 miles.
Okay.
I was very impressed.
It's a great way to attack a very serious disease, doing the least amount of trauma to your body.
Gerald is back in the great outdoors. He recently completed a hike of his dreams down to the bottom of the Grand Canyon and back. He was the first person to have this robot procedure in San Antonio, and he's glad he chose that option.
It went very smooth, and I would recommend it to anyone.
Expert cardiac care that treats the disease while helping the patient recover more easily. That's the difference. That's Baptist Care. For more information, log on to baptisthearts.com, or to connect with Baptist and find a physician, call 210-297-7005. For the Baptist Health News Network, I'm Wendy Rigby.